Hello, I am Ulf Pape from Germany. In this clip I show shortened treatment steps for special treatment of lumbar back pain. You could integrate many known technical skills into the individual treatment. The lower back pain can radiate to the sacrum, to the buttock, to the hip joint, and to the lower extremity, you know it. Okay, we start. I lift the patient's leg. I put on the patient's leg over my leg. My toes of my put on foot point towards the patient's foot. I start with the treatment. At the same time, I do sliding, mobilization, and the acupressure between the transverse and spinous processes near the spine and into the vertebral holes of sacrum. Here you can see it. I change the position. I am very, very relaxed. I move my body a little bit like a Tai Chi performer, like a dancer. All my power comes from the center of gravity. I am always in the flowing movement. Now I will mobilize the hip joint, my patient's hip joint, and I use the leverage. I form my forearms like a lever. My hand grabs into my other forearm, and I turn my body inside outside. For this reason, I can mobilize my patient's hip joint. I mobilize my patient's hip joint, and I start at the same time with a sliding fascial treatment. I use the bones of my forearm. You can see it. It's a fascial sliding, a laminar fascial sliding, and I will treat the central lateral trigger band line. I form my hand into a claw. I start from the os sacrum over the tensor muscle, over the iliotibial tract, until the insertions of the iliotibial tract and over the insertion. My shoulders are loose. All my power comes from my center of gravity. My flow is like a wave, more or less. You see it? I can change the position of my hand. And I start again. Very often it's a very sensitive area. I must be careful. And I am on the flow. I change the position of my hand. I can integrate other lines near the lateral iliotibial tract middle line, also the line of the quadricep muscle. It's more or less a lateral line. I can play with my possibilities. Now I turn my body. My patient's straight leg is in front of my body. I can stretch the leg. I can stretch the hamstrings. I press my knee into the hamstring. At the same time, I pull this thigh against my knee, against my pressure. Now I rotate my body. See it? In this position, My patient's back is stretched. It's in the stretching position, you see it. And I work with my fingers between the processes, near the spine, over the gluteal muscles. Now I will treat a very important iliopsoas trigger point area. You find this area near the straight abdominal muscle at the level of the colon curvature. In a real treatment, I stay there approximately 1 minute. I go very, very deep. I give pressure with the patient's exhales. I go very, very deep with my thumb. I can use also my finger, but in this position is better with the thumb. At the same time, I pull here over the piriformis muscle with my claw. You see it? I can integrate a trigger point treatment in the area of the lateral gluteal muscles. Now I have a long stretching of the piriformis muscle, and I combine this long stretch with a lateral stretch with a friction over the piriformis muscle. I change the position of my patient. My patient's leg is bent. And I change my position. Why I do that? That is the position before. If I like to shifting optimal my center of gravity for the next treatment step, it's better I change my position. My leg is over my patient's belly. My patient cannot come in the hollow back. There is my leg, you see it. Now I can stretch the one-jointed adductors. I can integrate gentle palm steps. You see it. I cruise my arms also. I have a good stretching. Now I will treat a typical, very sensitive trigger point area of the adductor muscles near the groin. Near the groin. And that area is very, very, very sensitive. For this reason, I have a special strategy. I like to press there, but this area, it's so very sensitive. What I do, I press with my other hand the foot sole of my patient's foot sole. You see it? And here with this hand, I press typical potential trigger points from the adductor muscles. At the same time, I do both. If you press the sole of the patient's foot, at the same time, the pain of sensitive points will be not more so painful. Okay, now I stretch a little bit. I am soft, and that is the end of the first exercise. See you again.